Why is the infertile man treated so badly? You want to find out more? Please watch this video. I'm Dr. Malpani. I'm an IVF specialist at Malpani Infertility Clinic, and our website is www.drmalpani.com. Now, when I say the infertile man is treated poorly or badly, this means that the quality of medical care which is provided to infertile men is pretty pathetic, and that's true for multiple reasons. Let's start from the beginning. For one thing, whenever a couple has a problem getting pregnant, it's always the wife who's blamed. It's never the man's fault. After all, he's having sex, he's potent, his libido is great, so how could he possibly have a problem? So that's step number one. Because the man refuses to go for a sperm test or doesn't even know that he requires a sperm test, the diagnosis is often not made in a timely fashion, which means a lot of time and energy gets wasted, and it's much later on that they find out that the wife is absolutely fine, but it's the man who has a problem, and that causes a lot of heartburn. And sometimes doctors contribute to this, because typically the first time you have a problem, you usually go to a doctor, and the doctor is a GP who then refers you to a gynecologist, because it's always the woman who wants to have a baby, right? And the gynecologist has no idea what to do about infertile men. He's never seen a man, because by definition he's a gynecologist, he sees women, and it's all a little unfamiliar and strange. Most of them have enough sense to at least get a semen analysis done, so that's fine. Now that's where the second set of problems arises, because most labs don't have any idea about how to do a sperm test properly. And I think part of the problem is the sperm test is so cheap, it's inexpensive, it doesn't cost much money. It doesn't cost much money because all you require is a microscope to see, hey, are there sperms or not, are they moving or not? Which means it's not done well or properly at all. The technicians are terrible, they write whatever rubbish they like, no quality control, no check. It's actually extremely complex procedure, because you need to dilute the semen sample properly to make sure that your sperm count is reliable. You have to actually measure how many of the sperms are actually moving, what's called sperm motility, all of which is difficult to do, but it's very easy to approximate or guess, and there's no documentation. You write whatever report, who's going to counter check? No one really cares, and get all kinds of rubbish. I mean, I'll tell you a simple thing. Lots of labs don't even know what a normal sperm count is. We know that a normal sperm count is more than 15 million per ml. But you will still see lab reports where they print normal sperm count more than 60 million per ml. Now you tell me, if the lab doesn't even know that a normal sperm count is more than 15 million per ml and still says a normal sperm count should be more than 60 million per ml, what good could that lab possibly be? Why would I even look at that report? I'd throw it away. So these are some of the problems with the man, and societal stigma and impact with the gynecologists, with the lab reports. It doesn't stop there either. Even when these couples go to the IVF specialist for their treatment, the problem still doesn't get solved. Typically, the IVF specialist will say, well, I'm an IVF specialist, I'm a gynecologist, I don't understand anything about treating male infertility. But you know what? In our clinic, we have a male infertility specialist. This guy is an andrologist, and he'll fix your problem. So what does the poor andrologist do? Like everyone else, of course, he tries to fix the problem. So he examines the man in great detail. He orders lots of tests, including testosterone levels and FSH. All useless, but got to do something, got to show he's adding value. Gets ultrasound done, gets a Doppler to check for varicocele, all of which is pointless. Lots of men will have varicocele, but treating the varicocele won't improve their sperm count. But no one ever tells the poor patient this, which means not only do they end up wasting a lot of time, money and energy on doing all these useless tests, they often end up doing varicocele surgery, which doesn't help them a bit. But that varicocele surgery is the bread and butter for most andrologists or male infertility specialists or urologists, so they're going to keep on doing it. And they'll always talk about, there one patient whose sperm count increased, but no one knows whether it increased because of your surgery or in spite of the surgery. And they won't talk about the 99 other patients where it didn't make the slightest difference at all. So obviously by the time the poor guy's done his varicocele surgery and it doesn't work, he's lost all confidence. But then, okay, you go back again to the IVF specialist. Okay, no problem. The andrologist couldn't help you. I will help you. I'm the IVF specialist. We'll go ahead and do IVF or ICSI or whatever for you. Again, this works well if you have a good IVF clinic, but when you have a bad IVF clinic which doesn't know how to do ICSI, you'll be surprised how many IVF clinics don't even have a full-time embryologist who doesn't have the experience or the expertise to do any of these procedures properly, which means actually when he's doing ICSI and he's taking the egg and injecting a single sperm inside the egg under a microscope, he actually ends up killing the eggs rather than fertilizing them, and the poor patient doesn't know any better. And then the next day, the doctor has the cheek to tell the patient, none of your eggs fertilized. They didn't fertilize because the embryologist killed the eggs by doing ICSI, but he won't say that. Oh, they didn't fertilize because your husband's sperm count wasn't very good, and we told you his sperm count was very good, and we told you to use donor sperm, and it's because you didn't use donor sperm, that's why none of the eggs fertilized. Rubbish! It's because your lab was terrible. That's the reason the eggs didn't fertilize. With ICSI, you literally require just one sperm to fertilize one egg. So even if there are very, very few sperms, they will fertilize after ICSI. And if they don't, it's always a lab problem. It's never a sperm problem. But doctors don't tell you the truth, and by now patients are fed up. All right, forget it. I don't really care. I just want a baby, so we'll go ahead and use donor sperm. But that's bad advice. When you can have a baby with your own sperm, then why do you want to use donor sperm? And you know what? Even if your sperm count is 0, you can still have a baby with your own sperm, provided you go to an IVF lab which has the expertise to do sophisticated surgical sperm retrieval procedures called PISA and TISA. And that's the final problem. A lot of IVF clinics aren't set up to do these procedures because they don't have a full-time male infertility specialist or andrologist, which means they're dependent on some urologist or andrologist to come and do these procedures. And obviously urologists are very busy and they've got other things to do, and they can't come when the egg pickup is being done, so they sit and do these procedures electively beforehand. But the sperm is there, but there are no eggs, so they freeze these sperms, which is not good for the sperms at all. But they don't have any other option in these clinics because they don't have a full-time andrologist, and that's terrible. Ideally, all surgical sperm retrieval procedures should be done after the egg is out, which means the moment you have the egg out, you can immediately put the sperm and the egg together. So using fresh sperm. Unfortunately, patients don't know all this, and they end up getting botched up completely, and they don't get pregnant and they get fed up, which is really tragic. And if you do want to find out what the right solution to your problem with male infertility is, then please don't be poor or get poor quality care. Make sure you get the best care. And if you want a free second opinion, hey, reach out to me. I'm Dr. Malpani. Our website is www.drmalpani.com. I offer a free second opinion. Just fill in the form. Everything is confidential. I'll be happy to reply to you in 24 hours. And we look forward to helping you to have a baby.